Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Huntington's disease. What is Huntington's disease? Huntington's disease is an autosomal dominant neurodegenerative disease characterized by involuntary movements. There is chorea here, psychiatric disturbances like that of depression, mood changes, even suicidal thought, and erratic personality, and cognitive decline that may lead to dementia and loss of memory. Age of onset 30 to 50 years. It may happen earlier. We have some juvenile type of Huntington disease. It may manifest after 50 years, up to the age of 70, but this is the most common time. Prevalence 4.1 to 8.4 cases per 1,000 persons. Etiology, what is the cause of Huntington disease? The responsible gene is the Huntington gene located in chromosome 4. There are multiple CAG trinucleotide repeats, more than 34, in the Huntington gene. A normal person should have repetition but less than 34, maybe 10 to 20, or maybe at least 33 at most. But if it is more than 34, then there will be Huntington disease. Okay, what structure of the brain is affected? It affects the basal ganglia. The caudate nucleus, putamen, are part of the basal ganglia. And it also involves the frontal lobe of the brain and the temporal lobe of the brain. What happens here? We have normal gene 10 to 26 CAG usually. But here, Huntington disease, gene containing 35 or more CAG repeats. There is CAG, trinucleotide expansion. Okay. We have expanded polyglutamine tract is here. Okay. So it is elongating because of repetition. So this is the Huntington disease. What is the function of Huntington gene in human is not known in a normal person, but in Huntington disease it becomes abnormal due to repetition of the CAG, cytosine, arginine, guanine. Okay, so we got that. Pathology, atrophy, greater in the caudate nucleus, and putamen. These two are part of basal ganglia. Then the cerebral cortex, particularly frontal lobe and the temporal lobe. Degeneration of the cholinergic and GABAergic neurons. Gyri atrophy is seen in the frontal and temporal lobe. And here caudate nucleus and putamen are going to be atrophied and degenerated. So we may get an hydrocephalus ex vecu. Due to degeneration of caudate nucleus and putamen, will get hydrocephalus ex vecu. There will be cavity formation inside the brain. Additional features of inheritance, anticipation. There is trend towards earlier onset in successive generation. So his father has the Huntington disease at the age of 45. His son will have Huntington disease at the age of 42. Grandson maybe at the age of 38. This way. What is paternal descent? Anticipation is more pronounced in individuals who inherit the disease from their father. So what are the initial symptoms? Chorea. What is chorea? Involuntary movement that are brief, irregular, dance-like and wreathing. Behavioral changes, moodiness, depression, suicide. And suicide is 5 times more common among the Huntington disease patient. There will be dementia. Diagnosis, history and symptom. If there is a family history, you can easily go to the diagnosis. Test for CAG trinucleotide repetition. It can be tested in the blood. CT scan and MRI of the brain will give us good idea of the brain, anything wrong, anything abnormal. We'll find out that any damage due to the disease process. Treatment, there is no curative treatment. It is a lifelong supportive treatment. We need genetic counseling so it can be detected. The problem is that a lot of people, the disease is diagnosed at the age of 35 or 40. By this time that person has transmitted the defective gene to his children. But it is an important point, genetic counseling. Medication that will prevent seizure. There is a tetrabenazine. This is a medication that is supported by FDA. FDA approved it. Haloperidol, the neuroleptic drugs, old time. Amantadine, SSRI, selective serotonin reuptake inhibitor. These are used for depression in the patient. But most important treatment is the supportive therapy. Disposition, relentless course of variable duration, 10 to 12 hours usually, with progressive disability and death. Okay, and that's all about the Huntington's chorea. You can also call Huntington's chorea. And if you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.